If you have an assistant who will help you to open. And another concept here is that all three parameters should be in your line of vision. You don't have to move your head like this. Okay? So consciousness, patient, respiration in the back, and saturation again. All this.
In your pocket.
Yeah.
No, you will be in the video. I can't help that.
We open the oxygen and nitrous oxide cylinders.
So I started oxygen first. So let her be 100% oxygen. Then we going on properly. Oops. I'm just closing it for some time because I want this to be empty. Look, when I was doing it, it was too exaggerated. Now, what I'm trying to do is see when I try to pinch here, it is not growing. Okay? Next. Yeah.
Open the, we have already opened the cylinder. Now, nasal increase, that is the conduction tube. Determine the appropriate tidal volume. Begin nitrous oxide titration with 10%.
So before that, I'm going to put the pulse.
Assess the patient's signs and symptoms of appropriate sedation. So for a whole 3 minutes, we give 100% oxygen.
Yeah. There are 2-3 things which you need to keep in mind. Crossed legs is a relaxed posture. Most of, at least down south in Andhra or Tamil Nadu, Karnataka, most of the mothers tell their daughters to cross their toes like this. What's up with that? Okay? If you see any South Indian mother lady, they lie down, the toes will be crossed. That will keep the legs free. Once you relax, you have to like this. And you always try to expose the toes so that when there is a reason for paresthesia, people will start moving the toes. Okay? So if you wear the shoes, you are missing one sign. It's okay if they wear, but if you can remove it, that's much better. That's right.
So the legs have to be crossed or they can...
No, whichever way. We need to observe the signs of relaxation, that's all. It's not that you have to keep this way. But if you can keep the toes open, you will know whether when they move the toes, that will show you the signs of paresthesia, which can be anywhere between crossover between plane 1 and plane 2. Plane 1 and plane 2.
No, we start like
So I try not to mention the percentages in numbers. Ramping up is very, very important. So ramping up is 0 to 10, 1 minute, 10 to 20, 1 minute, 20 to 33 minutes, 30 to 43 minutes, 40 to 45, 3 minutes, 45 to 53 minutes, 50 and above probably can wait for even 5 minutes. Yeah? That will never, it will prevent 50% of adverse effects because of nitrous oxide. This is called titration. Titration will give you the ability to control known the drug which is released out of the machine or drug which is going to be getting into the body. Another interesting thing what you have to also know is that, say for example, if I am releasing about 70% of nitrous oxide here, absolutely, absolutely. Is it beating very fast, you said? No, I'll ask it to stop. For example, if the machine is supplying about 70%, when you actually measure the nitrous oxide on the nasal lobe, it will be 50%. If you measure at the pharynx, it will be 40%. If you measure it at alveoli, that will be probably anywhere between 10 or 20%. So meaning, the nitrous, what you said exactly doesn't, because this is not a closed circuit like an anesthesia. In anesthesiology, the gases come out, there's a tube which is going to be pulled. The tube is sealed because of the cup which is in it. And the whole thing, there is no possibility of leaking. Plus, you will put a throat bag. So all these things will prevent any leakage. So that's a closed circuit. It's not a closed circuit. So there is so much of possibility of gas getting leaked. There is so much of possibility you inhaling. So effective sedation, effective nitrous, what you release here may not be the same. Yeah.
No, but it will be the withdrawal symptoms sir, of nausea and headache, or it can be when you get pain free also.
Sometimes even after the procedure also you may.
And can it be pain free also?
It can be.
In stage 1 pain free, can the nausea and headache?
So nausea and headache are more likely to happen in plane 3 and stage 2.
Stage 2 and pain free.
Plane 3 and stage 2 also.
And post withdrawal, only
That
headache.
also,
Then
that also may nausea. Plane 1. 1 minute. Plane 2, 3 minutes. That's why I said plane. You will understand better. So when I say plane 1, you know the symptoms, you know the percentage, you know the time. So plane 1 is 1 minute. And plane 2, excuse me. Plane 3, 3 and above. How are you feeling? Plane 1, usually nothing will happen. It is only going to give you the ramping up effect. Plane 2 is something you will start having certain initial symptoms. Yeah, I prefer not to mention that. You can come in.
sir, it mentioned that uterus was running at 14.7 psi at this temperature. What if the machine is installed at extreme temperature in our condition? Then
I said at this barometric pressure, 104 of nitrous oxide is not a possibility. Okay? So at a higher altitude, the partial pressure will be less. When you go deeper into the sea, the partial pressure will be more. So depending on how high are you, there could be slight variation in the depth of the sedation, but not significant.
Actually, how many purchase files do you have?
does the temperature will affect? Temperature.
It shouldn't vary that much. It shouldn't vary that much.
And so when we administer
See,
oxygen,
remember,
if we administer oxygen through oxygen concentrate, we humidify it and give it. We generally humidify.
Yeah.
What is the concept here?
we still breathe
you
through the
feel any
nose.
tingling?
So a little bit of humidification will happen, but this is flow a little more than what you normally get. So
Sir, have you witnessed any patient who you have administered nitrous oxide and closing of?
okay. Do you have contacts with you? Are you wearing contacts? Okay. People who wear contacts, when air the blow onto the eyes, you will start having burning sensation because the contact lenses are going to work on surface tension. So there should always be a little bit of lacrimal secretion between the contact lens and the eye. So when it dries, you will feel little burning sensation. So it's a good habit to take the contact lenses before the procedure. How many of you are wearing contact lenses here? One? Nobody? No. You have a spectacle? Not here. You have spectacles? Keep eyes open now. If you expect the eyes being open, then you will know the blink rate of the eyes and the movement of the eyes. That's one sign. So always try to keep eyes open. Encourage them to keep the eyes open.
So, have there any patients slept or dozed off while?
There's a possibility. There is a possibility, yes. Then how will I know? I have to tell the child to keep the eyes open all the time. If the child continues closing, there are two possibilities. Either sleeping or hypersedation because of nitrous oxide. If I simply reduce 10%, if it is nitrous oxide, they will be normally. If it is sleeping, they will sleep anyway. I'm going to take a 3-way syringe just blow once. Nitrous oxide is not going to take away pain. If you pinch, she will slap you back. Analgesia from nitrous oxide will happen in stage 2. We are not in stage, we are not even crossed plane 1. Yeah. So the weightlessness is going to put you in plane 2. Plane 2. That sometimes it can happen in 20%, sometimes it can happen 30%. That is because of paresthesia. Because of paresthesia, your back will become numb and you don't feel whether you are lying down on something, you feel floating. Now, this is the time where we can consider doing the treatment because relax. Are you not relaxed now? If somebody has alcohol, I'm sorry I have to bring alcohols here because that's one analogy I can give. It's like having a couple of pints. Yeah, it will not knock you off, but it will put you there.
Now you know.
This is, I guess, sir, in safer than giving nitrous oxide.
इसके साथ हाँ क्या
Now you can keep your mouth open.